Hello and welcome to Cellular Sonics, an amazing combination of osteopathic healing information from me after 20 years of osteopathy and collaborating with my friend here, Eeshi-Ra Hart.
Eeshi-Ra Hart, and I've got 20 years of experience as working with sound frequency and also about 30 years working as a bodyworker. And together we have created this online course bringing sound and anatomy together to work not only at a structural level, but also to benefit at a cellular deep level.
So after having met Eeshi-Ra about 6 years ago now, she came to me after having a little bit of an accident on her motorbike on your ankle. Eeshi-Ra introduced me to tuning forks. And from that, I had a couple of sessions with her, and with the experience that I felt myself after being very much of a structural osteopath and feeling the frequencies through my body, through my bone, I really got present to the fact that these tuning forks hit and get to places that I felt that I could not get to. And this is running through the depths of the trabeculae, through the bone, and getting really, really, really into the modality of healing at a different depth, which is why we've called it cellular sonics. And the practitioner tuning fork set that we have pulled together is really important for all of the modalities that you treat within your work. Ranging from, for example, I've been treating numerous people with broken bones post motorbike accidents in Bali. And this has been so helpful on one of the tuning forks to help with bony remodeling, to help with the trauma of bone, to help with the healing of the bone and the unification. So for all of you physiotherapists out there, physiotherapists, you have such an amazing, diverse amount of people that you treat through the range of hospital departments, from cardiovascular patients to respiratory patients to rehab to trauma to sports therapy. And for you guys especially, these practitioner tuning forks that Eeshi-Ra has picked specially, that I now use really covers the specifics of what we treat, including inflammation, pain. What else have we included there, Eeshi-Ra?
Yeah, we've got frequencies for wound healing, we've got frequencies for bone healing, fractures, dealing with fractures, treating trauma, helping ground at the end of the session, and there's also working post-surgery.
Yeah.
We have a wide range, and these frequencies aren't, we're not just offering a sound healing journey here where someone just lies down and has a nice relaxation. We're actually offering medically researched and scientifically shown precise frequencies, which you can go on to any medical website where you've got all the papers there, and you will start to see there's actually a lot of research now, particularly as more and more people get tuned in with sound. It's probably the oldest modality in the book, but people are, have forgotten that for a very long time, and it's just now coming back into the public domain, and certainly in the mainstream, it's really hit mainstream now, the use of sound frequency. So by using specific frequencies, we can then enable you as someone who's learning that to bring better patient healing outcomes.
Yeah, I think it's been an amazing collaboration of the sound healing with hands-on treatment. I utilize it at varying stages through my treatments. Might be at the beginning to calm somebody down, to actually bring them into their body a little bit more so prior to then working with them. It does help calm people down that might come in after a busy day, and then you're like, okay, let's just calm you down. And I'd really like to be present and conscious with our treatment. So actually we can go further and a lot deeper within the treatment. And the tuning forks has really enabled me to go there. I have many testimonials from people with aches, pains, fractures. You've got a great one there with lower back and neck problems, haven't you, of people that
Yes.
you
Yes, this lady, she got a tuning fork from me, and she'd been going to the chiropractor for about 2 months, and she was going there for shoulder, neck, and back pain, and she was really not seeing very little, much improvement. And once she started using the tuning fork, she said it stopped mine and her daughter's pain in just 2 days. 2 days, real story. She says, true story, and that's a lady in Canada.
So I love this collaboration of utilizing both, because if you can bring that sound into your work, I found that it's starting to talk to the body in a different way, and that conversation that sound can have, I don't feel my hands can do, yet I feel my hands can do so much, but this just adds on a little extra special touch.
And I also love it because it's helping the patient really tune in on their body. It's like if they come in and they're quite busy in their mind and they're not very grounded and they're all over the place, a bit scattered, but you give them a sound on their body, suddenly they drop out of the mind and they drop into the body, and they then start feeling their body. And it's a beautiful way of helping them become more engaged with the healing process. And we also teach during this course, we teach different ways that can enhance energy flow by getting the client to be more proactive so that energy can shift, and lymphatic drainage is better, inflammation is reduced, and frequencies also for wound healing, dealing with 3 phases of healing. So there are many options for you with sound that you wouldn't necessarily have with your own practice, because it's getting in at that deeper level.
Yeah. So we are just all go for sound healing right now. So please join us on board with our course that we have and the tuning forks that we have specially chosen for you as a therapist. So we have the link below here. Join us, ask us any questions, and look forward to hearing from you.
And thanks so much for your time. And we have a special offer for the rest of this month. We have a very special discount. So if you'd like to bring the power of sound into your treatments, everyone's getting into it now. It's hitting the mainstream. So we'd love to have you join us. Thanks then. Bye.
See ya.